Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, I want to share 5 tips of how to better manage bipolar disorder. These tips that I'm going to share aren't necessarily from the literature, they're more so from my personal experience with bipolar disorder, as I've had 5 manic episodes over the course of 5 years, and I feel like I've learned some things along the way that may be able to help you. So the first tip I'd like to share would really be to be patient with your medication and to give your medication a fair chance. Even with myself, I've tried many different medications over the course of 5 years, and it really took me a long time to figure out the right medication for me, as well as the right dose for me. In terms of antipsychotics alone, I've tried Abilify, olanzapine, Latuda or lurasidone, as well as other antipsychotics, until I got to the point where I finally found a medication that worked for me in Zeldox or ziprasidone. But even with that medication, when I first was prescribed it, I was using 20 milligrams once daily, and on that dose, I still had a manic episode. So it wasn't until I was prescribed 40 milligrams twice daily that I really found the right kind of setting for me, and then after that point, I went 2 years without having another manic episode. Some of the medications that I stopped were because I had an episode on that medication, or it just wasn't really quite effective for me personally. Other medications I had to stop due to side effects. As an example, when I was using Latuda, I had restless leg syndrome on a 20 milligram once daily dose, and that just was a little too hard to deal with for me, so I had to stop the medication and switch to another one. So it does take time to find the right medication at the right dose, and you may have to switch medications due to side effects or due to inefficacy. The best tip I can give in regards to being patient with your medication is really to trust in your healthcare professional team, whether that be your family doctor, your psychiatrist, or even your pharmacist. They all kind of have a plan in place and they know how to work through the plan to help to get you where you need to be, but you really have to put trust in them and know that eventually you'll get to that place. The second tip I'd like to share involves sleep. So like I said in some of my other videos talking about bipolar disorder, the first thing to go when you're on the path towards mania is your sleep patterns. For that reason, it's really important to be on top of your sleep and keep track of your sleep patterns, whether that be with your phone, with a diary, or just keeping a mental note of how you're doing in terms of sleep. With me personally, I've made myself a rule that if I don't sleep at least 7 hours for 3 consecutive nights, I'll use an antipsychotic known as loxapine to help me kind of get a good sleep for at least 3 nights again, and kind of reset everything. And it gives me kind of that confidence to know that I have something in my repertoire of medication to stop me from going to that path towards mania. When I am moving towards mania, I definitely notice that with my sleep patterns, they change in the sense that I start getting up earlier in the morning to get things done, work towards goals, work towards ideas, and also staying up later, so going to bed later, because it feels like it's almost a waste of time to go to bed when you have so much stuff you have to do and so much stuff you have to accomplish. The way I generally handle this, in terms of keeping track, is to have a conversation with my wife every couple days just to kind of check in and see how I'm doing. Obviously, we sleep together, so she kind of knows how I'm doing in general with falling asleep. But if I wake up in the middle of the night, or if I wake up early before my alarm clock and can't get back to sleep, I just share those conversations with her, and then we just have a conversation and make it a determination of whether or not I should use medication for the next couple nights. To make sure that I get a good sleep on most nights, I do use a medication known as Zopiclone or Imivane, just to kind of take away that anxiety and that stress of trying to fall asleep. I do find with myself that because I know sleep is so important with preventing mania, if I don't fall asleep within a half an hour to an hour, I do get a little bit anxious, and that prevents me from falling asleep even further. So I do use Zopiclone or Imivane, like I said, on a nightly basis to help me fall asleep. The only time I won't use this medication is if I'm using a different medication for sleep due to different circumstances. The third tip I'd like to share is about having a very strong support system around you. So myself, for an example, I really rely on my wife, my sister, and my aunt to kind of keep tabs on me and make sure that I'm doing okay throughout the year, especially for me from about October until March, as that seems to be a hard time for depression for me. So I have open, honest conversations with them, let them know how I'm feeling, and give them kind of the permission to check in on me and voice their concerns if they think I'm not acting like myself. This is important in the springtime as well, but instead of from a depression standpoint, more from a manic standpoint or a mania standpoint, in that in the spring months seems to be the time of year where I personally seem to have manic episodes if I was to have one. So during that time of year, again, we've had conversations, and I told them that they have complete permission to approach me and tell me that if they don't think I'm acting like myself or if I'm acting a little bit peculiar, they can tell me and we can make a plan in terms of medication or in terms of other remedies to help stop me on the path towards mania. I realize this can be hard for some people to kind of get that support system in place, as not everybody has the same situation in terms of friends or family, but there are usually local telephone numbers you can use to call mental health lines, and they can be a great resource for stuff like this as well. The fourth tip I'd like to share is about trying to do things aside from medication, so non-pharmacological approaches to try to help better deal with your bipolar disorder or even your other mental health issues in general. For me personally, I find it very beneficial over the last few years to see a psychologist. During the winter months, I see a psychologist about once every 2 weeks. And then during the spring months and the summer months, I see them about once a month or once every 2 months, just to check in. Now, in these conversations, we just kind of go over how I'm feeling in the present. It's a good person to keep tabs on me because from appointment to appointment, they can tell whether or not there are any differences in kind of the thought patterns that I'm having or the conversations I like to bring up. So if they do notice a change, they can tell me that, and I can bring that information to my psychiatrist to make medication changes or bring that to my support system to put a different plan in place. But the biggest thing that I find is that we almost got to a point where, looking at my past, we almost addressed what we think was the trauma in my life that may have precipitated the bipolar in general. Obviously, there is a genetic component, and there were some of my behaviors that may have led to a manic episode in the first place. But we do think that there was some trauma in the past that led to that. So if you can identify that trauma and help deal with it, bring it to light, talk about it, and like I said, help deal with it, it can help, I find, tremendously in the present. And the fifth and final step I'd like to give to people that have bipolar disorder to help better manage their bipolar disorder is to stay away from mind-altering substances, so mainly drugs in general. But when I think of this, I really think of cannabis. I do know that a lot of people with bipolar disorder do use cannabis, and I was one of those people in the past. I recently made a video about this, if you'd like to check it out, about my opinion about using cannabis in bipolar disorder. But to kind of summarize it, I really don't think it's a good idea to use cannabis as well as other mind-altering substances if you do have bipolar disorder. I noticed that out of my 5 manic episodes, my 3 most intense episodes were the ones where cannabis was involved, as when I became hypomanic, I would start smoking cannabis, and then it would push me towards mania, and I would increase the amount of cannabis that I was smoking, and that led to psychosis, where I experienced hallucinations and delusions. A lot of people with bipolar disorder tend to use cannabis to try to combat the depressed phase of bipolar. That's what I did personally. Whenever I was feeling depressed in the past, before I was diagnosed with bipolar, and even in between a couple episodes, but I would use cannabis to help deal with the depression, to help lift my mood out of the depression. But that always led to negative outcomes in that as time went on, it would slowly push myself into that path towards mania that I keep referring to. So the best piece of advice I can give in terms of those people that use cannabis to combat depression, just realize that there are other things out there besides cannabis that you can use to help combat depression. Personally, I'm now using Wellbutrin 450 milligrams daily. Started off with 150, eventually made my way to 300, then to 400 milligrams. But I find a tremendous difference. Just even a month ago, I was very depressed, found it hard to do my day-to-day activities. But after being on this medication for some time, I do feel back to myself. My energy is back, my drive is back, my ambition is back, and it does feel great. Now, in the past, when I was feeling that way, I would have smoked cannabis. And aside from that pushing you into mania, if you are starting down that path, it really kind of dampens your senses. It makes it harder to kind of notice changes in yourself. That might be a trigger to give you a warning to say you're on that path. So all in all, you can talk to your doctor, obviously, about getting something else to help combat depression. But I just wanted to put it out there that there are other things besides cannabis that can help you in your battle with depression. All right, that's all I really wanted to talk about today. Just 5 tips to help you better manage your bipolar disorder. Just coming from my personal perspective after dealing with 5 manic episodes in 5 years, and now having gone 2 years without having any manic episodes, I really find that these 5 tips really helped me tremendously. So as always, if you'd like to help grow the channel and you found this information valuable, You can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. That's it for today. Take care.